According to the American Medical Association, 28 million Americans suffer from headaches. Of those, it's estimated that 1 out of every 5 women and 1 out of every 15 men are affected. To find out more about new treatments for headaches, we spoke with Dr. Brian Boyd at St. Joseph Hospital in Orange.
Many of my patients come to me asking, why don't my headaches get better? And that's really a key aspect of how I take care of my patients. And one of the prominent reasons why their headaches don't get better is that it may be the wrong diagnosis. This is an example of how it'd be easy to make a wrong diagnosis. This is a picture of a woman with migraine, and as you can see, it's commonly on one side of the head. There are indeed 2 overlooked aspects that are relevant for headache patients. One is a concept of that there may be peripheral pain generators for their headaches. And this in particular is my passion practicing in pain medicine, that there's something known as myofascial pain. And this is where the pain generator is actually in the muscle. It's a condition of trigger points. And I've found that this is a very under-recognized aspect of the headache patient. And the value of recognizing this is that the treatment is different, and as you treat that peripheral pain generator, then their underlying headache disorder, such as migraine, is much more amenable to treatment, and you can then get them better once you recognize that. This, by contrast, is a patient with myofascial pain where the pain generator is in the muscle, as manifest by the X's on the muscle. Red's where the patient feels pain, and you can see how this is very similar to the unilateral one-sided head pains. This is an example of a trigger point, and as you can see, there's normal relaxed muscle fibers, but within the normal relaxed muscle fiber, there's that tight band of constricted and painful muscle fiber, and that's what I feel on exam. Within that tight band is that you see the red area, which is the trigger point, which is an area of irritability, keeps these muscle fibers tight, constricted, and painful and giving you problems. And this is just another example of a trigger point in a different muscle, but yet you can see there's overlap in where the patients feel pain. And this is an example of why we can never ignore the neck in our headache patients, because the trigger point's actually in the neck muscles, giving referred pain up into the head. The second aspect that's underappreciated and why headache patients don't get better is that they may well be rebounding from their medications. In effect, that the medications have become part of the problem. This is the key concept of withdrawal or rebound headaches, and it can cause 50% or more of daily headaches. It can be caused by caffeine as well as many prescription medications, and particularly the narcotics. The concept here is that as you take the pill, it helps the headache, but as the use and frequency escalates, it becomes part of the problem, and you get a withdrawal or rebound headache, have to take another pill to treat that withdrawal, and this vicious cycle occurs. The key here is to recognize it and detoxify the patient from this whole process. My particular passion caring for headache patients is the myofascial pain, looking for the trigger points. And there comes a point during the physical exam with my hands on, feeling for these different pain generators, where all of a sudden the patient says, "Doctor, you've got my pain, you found my pain, you're the first one who's ever done that." And that's a very bonding experience, and that's what I find gratifying. It's also very gratifying to me to be able to have the honor to treat that, and with, for instance, trigger point injections, which I sometimes do, the patient leaves the office feeling better than they walked in, and being able to allow the patient to take charge of their life again is what it's really all about.